Welcome to the fiscal year 2021 Health Center Program Expansion School-Based Service Sites Live Question and Answer or Q&A session. This funding opportunity is commonly referred to by its acronym SBSS. I am your presenter, Stephanie Christ, and I am part of HRSA's SBSS Technical Assistance team. I will be joined today by several colleagues from the Office of Policy and Program Development, or OPPD, and the Office of Federal Assistance Management, commonly referred to as OFAM, when we get to the question and answer portion of today's call. During today's session, I will provide a brief overview of the SBSS Notice of Funding Opportunity, or NOFO, and highlight some key points about the application before transitioning to answering your questions. If you've not done so already, please watch the SBSS Technical Assistance webinar for applicants, which is available on the SBSS Technical Assistance, or TA, webpage. This webinar provides a comprehensive overview of the SBSS NOFO. For the question and answer portion of today's session, please submit your questions at any time using the Q&A pod, which you can find at the bottom center of your screen in Zoom. Please note that your audio, video, and chat functions are disabled during today's session, so all questions should be submitted through the Q&A pod. Your question will only be visible to today's speakers. To view closed captioning, select Closed Captioning from the three dots icon in the bottom center of your screen, and then select View Subtitles. And finally, I'll provide a list of the available technical assistance resources for you to keep in mind as you develop and submit your application. The purpose of SBSS is to increase the number of patients who can access comprehensive primary health care. Sorry, let me start over one more time. The purpose of SBSS is to increase the number of patients who can access comprehensive primary health care through Health Center Program Award recipient service sites located at schools, which I will refer to as school-based service sites. The SBSS NOFO focuses on the expansion of health center services at schools that serve children and adolescents. A modification to the NOFO was released earlier today. A modification was not released earlier today. Please disregard that statement. For the purposes of this NOFO, school-based service sites are those located at or on the grounds of a school grounds including preschool, kindergarten, primary, and secondary schools. You will use SBSS funding to increase the number of patients accessing comprehensive services by serving more patients at new school-based service sites you propose in this application or at your existing in-scope school-based service sites. Keep in mind that all school-based service sites where you will use this funding must be located at preschools, kindergartens, primary schools, or secondary schools. This is anticipated to be a highly competitive funding opportunity. HRSA plans to award a total of $5 million to 25 health centers. You may apply for up to $200,000 per year. You may use up to $150,000 of the award in year one for minor alteration and renovation, which I'll refer to as minor A&R and/or equipment. This $150,000 is part of and not in addition to the $200,000 award ceiling per year. The 2-year period of performance will begin on September 1st, 2021 and last until August 31st, 2023. While SBSS funding will be issued as a new award with an H-2E grant number, all uses of SBSS funds must align with your health center program scope of project and be spent in alignment with all health center program requirements and regulations. Continued funding may be available beyond the 2-year period of performance. If funding continues, it will be awarded as part of your H-80 grant and will be based on your performance in increasing the number of school-based service site patients served, as well as the availability of funding. Now let's take a moment to review some key dates. As a reminder, applications are submitted in 2 phases. In the first phase, basic organizational and budget information will be submitted in grants.gov, which has a March 22nd deadline at 11:59 p.m. Eastern Time. Phase 2 is where the bulk of the application will be submitted in the HRSA electronic handbooks, otherwise known as EHBs. The EHB submission deadline is April 20th, 2021 at 5 p.m. Eastern Time. You must meet both the grants.gov deadline and the EHB's deadline to apply successfully. The award start date will be September 1st, 2021. Now that we've hit the highlights, I want to delve into a few areas where you might have the most questions. Let's start with the eligibility requirements. Only current H-80 Health Center Program Award recipients are eligible to apply for SBSS funding. Additionally, you must ensure that your request for funding is $200,000 or less per year, and you are eligible for SBSS funding regardless of whether or not you currently operate a school-based service site. If you currently operate one or more school-based service sites, to be eligible, you may either propose to use SBSS funding to expand services and increase patient numbers in at least one of your existing school-based service sites located at or on the grounds of preschool, kindergarten, primary, and secondary schools, or propose to open at least one new school-based service site in your service area located at or on the grounds of preschool, kindergarten, primary, and secondary schools. You may also propose to do both. If you do not currently operate a school-based service site, to be eligible, you must propose to open and operate at least one school-based service site in your service area located at or on the grounds of preschool, kindergarten, primary, and secondary schools. If you do not currently operate a school-based service site located at or on the grounds of preschool, kindergarten, primary, and secondary schools, and do not propose to open and operate at least one school-based service site located at or on the grounds of preschool, kindergarten, primary, and secondary schools in your service area, you will be deemed ineligible. HRSA will determine if your service delivery site is a school-based service site by reviewing the site setting field of Form 5B service sites and confirming that the school option is selected. If the school option is not selected, you will be deemed ineligible. If you have an existing service site, HRSA will review your Form 5B service sites and EHBs. If you are proposing a new site or proposing minor alteration and renovation at an existing site, HRSA will review Form 5B service sites submitted with your SBSS application. Remember, for the purposes of this NOFO, school-based service sites are those located at or on the grounds of preschool, kindergarten, primary, and secondary schools. You must also include a project narrative and a letter of support from each school and/or school district where service expansion is proposed. So this is for every school or school district where you will expand services, not just where you will add new school-based service sites. And finally, you must meet both the grants.gov and EHB's deadlines. This slide lists the forms you will submit with your application in EHBs. 4 forms are required, and the remainder of the form should be submitted as applicable based on your project. Everyone will complete all of the forms in the top box on this slide. You will only complete the forms in the bottom box of the slide if you are proposing new school-based service sites located at or on the grounds of preschool, kindergarten, primary, and secondary schools, equipment purchases, and or if you are proposing minor A&R projects. Everyone will also submit a structured 2-year project work plan as part of the project overview form. Your project work plan activity should address unmet need and increase the number of patients served at your school-based service sites located at or on the grounds of preschool, kindergarten, primary, and secondary schools. To complete your project work plan, you will select one or more services that you plan to expand, which are listed as focus areas. You will then select from predefined activity categories and subcategories. You can also select the other category and write in your own activity category and subcategory if the activity you plan on conducting does not fall into the listed categories. You may choose multiple activity categories for a given focus area and multiple activity subcategories for a given activity category. You will describe the service expansion related activities that you will conduct to increase the number of patients served at school-based service sites over the 2-year period of performance, including the time frame for each activity. If you are proposing a new school-based service site, your project work plan must outline activities that will ensure the proposed new school-based service site will be open and operational within 120 days of award. The EHB user guide provides instructions on how to complete the project overview form, and a sample project work plan is available for reference on the TA webpage. Before we transition to the question and answer portion of today's call, I'd like to reiterate the following key points regarding SBSS. The purpose of SBSS is to expand access to health center services by increasing the number of patients who access comprehensive primary healthcare services through Health Center Program Award recipient service sites located at schools or on the grounds of preschools, kindergarten, primary, and secondary schools. To do this, you may add new service sites located at schools, or you may expand one or more services at existing school-based service sites. You may apply for up to $200,000 per year for each year of the 2-year period of performance. You may not expand your service area through this application, and funding may not be used to support services provided on behalf of third-party entities, including schools and/or school districts. Finally, ongoing compliance is critical. You will not receive an award if you have an active 30-day health center program requirement related condition at the time of funding decisions. We have now reached the question and answer portion of our call. As I mentioned earlier, please submit your questions using the Q&A pod. Only HRSA staff will be able to see your question. We'll answer as many questions as we can and may combine questions as appropriate. However, we are likely to get more questions than we have time to address. If we do not respond to your question today, please check the FAQs, which will be posted soon on the SBSS TA webpage. And if your question is not addressed there, then please submit it to the SBSS Technical Assistance Team using the BIPIC contact form. We'll have Olivia Shockey consolidating and asking your questions and may have other OPPD and OFAM experts jump in as needed. And if you submit logistical questions about today's webinar, you may receive a response directly in the Q&A pod from the SBSS Technical Assistance Team. While our team gathers your questions, I will start by addressing some questions that we've received prior to today's call. Our first question is, can individuals who are not students be treated at the school-based service site? So in response, you must ensure that members of the general community will have access to all required primary healthcare services, not only during school hours, but also when the school is closed. This can be accomplished through providing services to those other than students, either at your school-based site, at other in-scope sites, or through referrals. Our next question is, are telehealth services eligible for SBSS service expansion? So, like all other health center program service delivery sites, a school-based service site, by definition, must include some face-to-face services. SBSS funding may be used to expand services through face-to-face and/or telehealth visits to patients at school-based service sites. For more information on different telehealth scenarios, see PAL 2020-01 Telehealth and Health Center Scope of Project located on the Scope of Project webpage. And the final question we'll state before we go to the live portion is, how does HRSA define a mobile unit? HRSA defines a mobile unit, also referred to as a mobile van, in PIN 2008-01, defining scope of project and policy for requesting changes. A mobile unit is staffed by health center clinicians providing direct primary care services on behalf of a HRSA-funded health center. Mobile units whose function increases the number of patients who access comprehensive primary health care through Health Center Program Award recipient service delivery sites located at schools are an eligible cost, and health centers may use up to $150,000 in year one for this purpose. In contrast, the primary purpose of passenger vehicles, which are not an allowed cost, is to transport health center patients and staff. Now I'll turn it over to my colleague, Olivia Shockey.
Thanks, Stephanie. So I can say with confidence that we will not be able to answer every question that is in the Q&A pod. We are up to about 150 questions at this point. Don't be discouraged. If you still have a question, you can go ahead and enter it at any point. But please note that if we do not get to your question today, it is important to us. We want to support everyone that's interested in applying for this funding and doing so. And so please do submit your questions through the BIPIC contact form after the call if we do not get to your question on today's call. So we're going to start with some questions that are focused on the purpose of the funding and eligible applicants. Can a school or school district apply for this funding?
So you must be a Health Center Program Award recipient, which means you should have an H-80 grant award to apply for this funding.
So if we are a school or a school district that would like to encourage a health center award recipient to select us as a site for a new school-based service site, how can we get a list of health center program award recipients so that we can do this type of outreach in our communities?
So there is a way that you can download a list use from our webpage. I will say though that you will have to be careful because what you will be able to download includes lookalikes who are not eligible. Okay. So I will let my colleagues tell you precisely how in the chat pod you can download that list. Otherwise, we can be sure to add it to the FAQ since it might be a bit technical to explain on our Q&A today, but you can access that list. Just be careful because it has both Health Center Program Award grantees and lookalikes. And remember, lookalikes are not eligible.
And I would just add that find a health center might be an easy way to see what health centers are in your community. So I would encourage organizations to use that as their first one-stop shop at the beginning for checking out what is already available in terms of health center sites in their community. All right. There is a question about community-based organizations such as mental health agencies. If a mental health agency already partners with a health center, can the mental health agency apply for this funding, or would the partnering health center need to be the applicant?
The partnering health center would need to be the applicant.
Are currently funded health centers eligible to apply if they do not already operate school-based service sites?
Yes, if you do not already operate a school-based service site, you are eligible. However, you must propose to operate a new school-based service site in your service area in the application.
And you'll be able to do that through Form 5B in the application. So if you have questions when you get there, we're happy to assist. Is this funding only available for health centers that are proposing new school-based service sites, or can the money be used to expand services at a current school-based service site?
The money can be used to expand services at a current school-based service site and or for a new school-based service site. So you are eligible if you already have a school-based service site.
Excellent. And so in that case, if you are not adding a new school-based service site through your application, you would not fill out information on Form 5B in your school-based service site service expansion application, because that form will only be applicable for organizations that are proposing a brand new site. Are there any priority points or preferences for this funding opportunity?
No, there are no priority points or preferences.
And I will just point out that if you are currently operating a school-based service site or more than one, or if you are currently have a focus on serving children and adolescents, you will see prompts to describe those experiences and that capacity throughout the funding opportunity when you are completing your narrative. So please take advantage of describing what you are currently doing as well as what you plan to do with this funding. Stephanie, we're going to move on to some questions that are more focused on sites and scope of project. So I know we have some policy experts on the line too, in case we need to pull them in. when applying, do we have to focus all of the funding on a single school-based service site?
No. First off, the project narrative asks that you propose your service expansion based on the unmet need in your community. So you can expand services across different school-based service sites as long as they are, again, within your service area.
And just keep in mind that the funding is capped. There is not a per site bump in funding that you're eligible to apply for. So multiple sites, you can use the funding at multiple sites, just note that it's still the same funding level. Can a school-based service site be located at a charter school?
Yes, school-based service sites can be located at both public and non-public schools. So that also means school-based service sites can be located at public, private, and or charter schools.
And can you just remind people, Stephanie, of the definition of school that we are using for the purpose of this notice of funding opportunity?
Sure, that is inclusive of preschool, kindergarten, primary, and secondary schools. So essentially, we're talking about schools serving students in grades pre-K through grade 12.
And we'll be posting some FAQs, as Jim would say, soon and shortly. And so you will see an FAQ that makes that very clear for you. What happens if a school where we are proposing our school-based project is not physically open come September?
So I'll also phone a friend for policy here, but one, I'm not sure if this is a new school-based service site, so those must be open within 120 days. And if we're talking about that this is an existing school-based service site and the school is closed for, any number of reasons, then you should operate outside. You should find another site within your service area, but I'm gonna let my policy colleagues weigh in here as well.
Thanks, Stephanie. This is Andrea. I don't think we would have anything to add to that. That sounds correct.
Thank you. And this is Olivia. I'll just add that if schools are not open come September, or there is a variability in school openings, that HRSA will take that into consideration. There is always the possibility that HRSA could extend that 120-day window for opening new school-based service sites if it is physically impossible to do so because the school is closed. So make your best plan with your application, assuming that that school will be open, and just note that HRSA will take multiple factors into consideration. Okay, let's move on to the next question. Can we use funding to embed community health workers at existing school-based service sites, to do an enabling services expansion?
Yes, you can use enabling service is one of the multiple service area types that you can do, that you can expand services with. So you can, and I'll just, if you'll humor me, the types of services that you can expand are primary medical health care, mental health, substance use disorder, oral health, vision, and enabling services.
Thank you, Stephanie. That's a good reminder. In addition to serving students, can our school-based service site provide services to staff?
Yes. So again, your school-based service site should be open not just to students. You're actually required to open it to members of the community, either through direct care at the school-based service site or through referring folks to other health center sites that you may have, or other referrals outside of your health center service site. Your goal is to ensure that individuals, regardless of whether or not they are a student, have access to care.
And if the school-based service site is going to serve more than just students as patients, how does that impact the measuring of the objective of increasing the number of patients served through school-based service sites?
So you will still count all the patients served at the school-based service site. So regardless of whether or not they are a student, the measure is called the total number of patients served at school-based sites.
So we would refer you to the UDS manual for the complete definition of that UDS measure, which I do believe includes like family members of students. We know that your site might serve more than what is included in that UDS measure, and that is okay. We just want you to be aware that the objective measure that we'll be using is that UDS measure. Going to switch gears, Stephanie, and ask a few questions that are specific to the required increase in school-based service site patients. Is it required that we add new school-based patients for this funding opportunity?
Yes. The goal of the funding is to increase the number of patients served at your school-based service site. So you must increase the number of patients served at your school-based service site.
And so I want to acknowledge that I've seen many questions in the question and answer pod about different types of service expansion, with statements that it's predicted that such service expansions would really benefit the current patients of the school-based service site and may not bring in new patients. And so I would advise that as you're planning your project, to keep in mind that the focus in terms of the objective measure is additional patients. But that does not preclude you from having a project that proposes multiple types of service expansion, some of which might benefit more patients that are already being seen in your site, school-based sites, and some of which might help to bring in new patients. If a patient who has not previously received school-based services receives enabling services at the school-based health center, would that count as an increase in patients?
So again, I'm going to refer you to the UDS manual that Olivia referenced earlier for the precise definition, but essentially, just because a patient is increasing their number of visits, that's still not an increase in patients, right? So if you had a patient who was, let's say, getting oral health and then all of a sudden got an enabling service, that still would not be an increase in the number of patients you serve. So, but
Exactly, Stephanie. The converse is also true, right? If you have a patient who has never been seen at the school-based service site who comes in to receive a service, then they count as a new patient. What UDS year will HRSA use as a baseline for looking at increases?
so your baseline will be the year 2020 data.
There has been an acknowledgement by many in the question and answer pod that the 2020 data might look very different than the 2019 or 2018 data. And so if that is the case for you, you have been operating school-based service sites previously and experienced a decline in school-based patients in 2020. You are welcome to talk about that in your application. Just know that HRSA needed to create a standard baseline across all applicants, and so we are going to use the 2020 data as a baseline for everyone. We would love to see our health centers, if they experienced a decline in 2020, to outperform their 2019 UDS as well, but the standard baseline will be 2020.
Right, and Olivia, if I could just add on one other thing. The NOFO does ask that you use that you project the number of patients you'll increase by and project your 2022 numbers. So if you have been serving, if you are an existing school-based service site and you have those numbers from 2018, 2019, let's say, please do use all of them when you're calculating your trends to help you project your 2022 patient numbers that you're proposing for the patient increase.
Thank you. That's a great addition, Stephanie. We have a handful of questions about eligible costs and developing budgets. And so I just want our grants management colleagues that are on the line to perk up their ears as we switch gears here. Can we use funding to purchase a mobile unit that will serve patients on school grounds?
Well, can we repeat the question one more time?
Sure. Can we use funding to purchase a mobile unit that will serve patients on school grounds?
Mobile unit is an allowable cost in this program.
If we predict that we will have program income associated with this project, do we need to include that in our budget proposal?
Any program that generates program income should report program income on your federal financial report, but also if you predict that you have program income, it should be listed in your non-federal costs when you put in your budget.
And what category on our budget categories would we use for items that cost less than $5,000, but sort of ride that line between equipment and maybe some other categories?
If it's a tangible item that's less than $5,000, it's considered a supply.
And Brian, would you categorize things like chairs, tables, and desks to fall into that category as well? If they cost less than $5,000, they should be reported in the supplies section.
That's correct.
Excellent. We have a couple of applicants that are looking to stand up new school-based service sites, so they are going to need some of that type of equipment. We also have a question about ongoing funding. So the funding opportunity states to apply for a 2-year period of performance. How will HRSA determine if funding continues beyond 2 years? And so before any of my colleagues jump in, I just want to throw out a few thoughts in this space. This is a new space for us in BIPIC. If you have been following along, you saw this type of language included in just one other funding opportunity before this one, and that's our primary care HIV prevention funding opportunity that closed just yesterday. So this is a new space for us. We are looking at awarding supplemental funds as separate awards, not as part of H80, for a period of 2 years, so that we can facilitate recipients better tracking the use of funds, right? It's easier to keep track when it's not all commingled, and to give HRSA the ability to make some decisions at the end of those 2 years about whether there's been substantial progress so that we can continue funding. We do not have a solid definition for what is enough progress to determine if my funding will continue beyond the 2-year period. So we invite you, if you receive this funding, to share your thoughts with us. This is, again, a new space for us, but we have told you what the measure will be, which will be the number of school-based patients per that UDS definition. So we expect that if funding continues beyond the 2 years, that we would probably need to provide a little bit of gap funding to get things synced up with your ongoing budget period start date. And so there could be more than 2 years of funding awarded as a separate award and then ongoing funding awarded under H80. But just wanted to be transparent with you that we are working in a new space here and we ask you to work with us as we navigate it. Anything that my colleagues would add to that?
Nothing here. Thanks, Olivia.
Okay, so I'm going to be going back over to the Q&A list to pull some additional questions for you. If any of my colleagues on the line have already perused that question list and have a few teed up that they want to ask, please feel free to do so.
Hello, Olivia. This is Rael, and as a housekeeping item, I'm happy to tell our audience that today's slides are available on the Technical Assistance webpage, where you'll also find a number of helpful technical assistance resources, including example forms. So I'll send that over in the chat pod right now.
Thank you. We have a question that our policy colleagues may be able to assist us with. There's an acknowledgement that the definition of a service site needs to include some face-to-face services. And so the question is, what is some? Is there a definition for how much face-to-face is required?
Hi there, this is Julie Breen from Policy. There is not a threshold for how much someone needs to provide. You can take a look at our scope pin, which is 2008-01, which gives some details along with the telehealth PAL.
Thanks, Julie. There is a question about how to properly fill out the budget request information and whether the total 2-year funding should be requested or whether it's just one of the 2 years and where to put the second year. Stephanie, can you provide a little guidance?
Sure. So just give me 1 second because I want to pull up one form to make sure that I'm giving you the most accurate information possible, because it gets a little tricky to tell you the truth, because there's one part that's not 100% intuitive. So just bear with me for 1 moment.
So Stephanie, while you do that,
Stephanie, I can probably jump
I
in
will, oh, I'm sorry, go ahead, Brian.
So the budget justification narrative requires that you provide both years worth of funding. So one budget narrative for year 1 and one budget narrative for year 2 by object class category. And they should generally align with the SF424A budget sheet when you put those costs in. Make sure those costs met make sure those costs mirror each other. Now, generally speaking, for the SF424A budget sheet, you normally have to provide the cost for 1 year. But if you look at the form itself actually has multiple columns. So if you actually have space, it actually might behoove you to have 1 column for year 1 and 1 column for year 2. Now, I realize if any of you have multiple funding sources such as public housing and migrant health and healthcare for the homeless, you're probably using those columns to put in those. But if you don't have to do that, then it would then be beneficial if you could put use 1 column for year 1, 1 column for year 2.
So Stephanie, I'm going to cycle this back to you because I know that you've opened the NOFO and probably some sample forms to make sure that we give a clear answer in this space.
Thanks, Olivia. And just to bear with me for 1 more second, can you repeat the question? Because I want to make sure I address all parts.
Right. So I think there's some concern and confusion, right? Many health centers applied for hypertension funding where we told them like you put all the money that you're going to use over 3 years on the form in like one box. This is different. You don't do that. And so I think people are just looking for some guidance or reassurance about how to list year 1 and year 2.
Got it. Got it. Got it. Okay. So I did pull up the guidance that we have for completing our SF424A here. So first off, I want to say that to Olivia's point, we are separating, and Brian's point, I think we are separating the years. So the amount in each row on your budget information form should not total $200,000. So I'm not sure what was for hypertension, but we wouldn't want to see in a given category $400,000, for example. The part that I think gets a little trickier is for your budget information. If you're going on sections D through F here, and this is getting a bit arcane, I know, but you'll see something that says future funding periods, years, and that might be what Brian was referring to, that has first, second, third, fourth. That first year actually is for budget year 2. Okay. And so that's $200,000. So as you're going through forms in grants.gov and EHBs, if you have any questions, the short answer is please just reach out to the BIPIC contact form and we can help you. And the general rules of the road are to keep your year 1 and year 2 requests separate. And part of that is because we have this one-time funding for year 1 of $150,000. So that's the main principle you want to follow. And again, it gets a little, you're going to have to follow. There's a great EHBs in addition to the NOFO and the sample forms, which Olivia mentioned. You'll also want to follow the EHB's user guide, which can help you figure out where to put what amounts as well. Because again, some of the things are not the most intuitive wording. Olivia, Brian, anything you all want to add?
Yeah, I'll just wrap this one up by saying that Stephanie's point is really important. There is an eligibility criterion around not requesting more funding than is available in a single year. So you would not want to reflect $400,000 in a single box on your budget form because the limit per year is $200,000. And Stephanie mentioned that up to $150,000 of that $200,000 in year 1 can be used for one-time costs. And so we've asked you to give us a breakdown of your year 2 budget as well in EHBs so that we can see if you are using funding for one-time costs in year 1, how you will be repurposing that across your object class categories in year 2 to increase your service expansion. So definitely, if you have questions as you go through, please do reach out. I've seen several questions about restarting school-based services. And so just know that you can definitely use this funding to expand services at sites or locations where you have already been providing them in schools. We understand that you may have had to take some time away from providing services in your school-based service sites based on the pandemic. And so you can certainly expand, like go back into those schools and expand services within those sites. And that could look like an additional provider or part-time provider to provide the same services you're already providing, to provide a new service. There's many ways that your service expansion project could look, but certainly it can happen at schools where you have already had a presence. I'm just looking for one or two more questions because I see that we're getting close to time. And please note that the questions have not stopped coming in. So I know that we did not get to all of your questions. We see the volume. We do encourage you to send questions to the BIPIC contact form, to us through the BIPIC contact form. And based on how many questions we were not able to get to today, we'll go through and categorize them. We may be adding some new frequently asked questions. We hope to get those up soon and shortly. And we may also elect to add another QA call if we feel like the volume would support doing this again. So just letting you know to watch the digest for any new announcements in that space, whether it's that frequently asked questions have been posted or whether it's that we may offer another call. Let's see, there's some questions about filling out the work plan and what kinds of activities fall under each of those work plan categories and subcategories. Stephanie, we have an example document up, right?
Yes, we do.
Okay, so I encourage everyone to go take a look at that example. One of the questions I saw specifically is, can you provide an example of workforce capacity activities? And so that could look like trainings for staff or maybe even hiring new staff so that you have additional workforce capacity. If an organization is proposing a mobile unit, can they have that mobile unit visit multiple schools, or is it limited to just one singular school?
So it can definitely visit multiple schools. The one thing you want to keep in mind is, are the schools in your current service area for your H80 or your health center program award grant?
Right, so through this funding opportunity, we are not expanding service area. And so if you are proposing a new school-based service site on Form 5B, you will see that there are business rules in that form that keep you from entering zip codes that are not part of your current service area. So if you run into problems getting that form completed, please feel free to reach out. The idea is that there are a limited number of awards that we are going to be able to make, and we really wanted to help support the in-reach to current service areas by our existing health centers. Would we be able to propose a mobile unit that focuses just on dental services for students?
Yes, and I'll actually expand that to just in general, a school-based service site. You can focus on just one of the services I listed. The key thing to keep in mind if you're doing that is that you have to make sure you're ensuring access to care through referrals to other organizations and or other health center service sites that you have, to make sure that those individuals have access to all of the required services that a health center site must provide. But at the school-based service site in particular, you can provide just one type of service, and that's inclusive of a mobile unit as well.
So I see that one of our post webinar polls is up, but I would like us to just take one or two more questions. We have some questions about what falls on that line between minor alteration renovation, which is allowed with this funding at a school-based service site, and what would not be okay because it falls into construction. So I believe we have an expert on minor A&R and construction questions that can jump in on this one.
Yes, thanks, Olivia. So with this funding, you are allowed to perform minor alteration renovation activities. So that's work inside an existing building, that in spaces that already exist. You can expand a space, but it would have to expand into another part of an existing building. So what you cannot do is to perform construction by creating increasing the footprint, so sometimes called, but it would be like building an addition onto a school or onto your current clinic space, or a mobile van is also considered, I'm sorry, a modular building. So a building that's brought into the site that's placed on permanently installed on a site would not be considered alteration renovation. That would be a construction of a building, even though the building was constructed off site, you would install it on the site. So that would also not be permitted. And then other types of activities around the site that are, I think the only exception we have outside of the building would be items to improve accessibility, such as curb cuts to try to get and striping of parking lots to provide spaces for handicap access.
So Bill, if
that helps
someone
a little
thinks
bit.
about it as allowable activities would be things that kind of change up the inside space to enable the school-based services, does that feel like it's an appropriate distillation?
Yes, that's a good way to think about it. And another thing to mention is just that we've been talking a little bit about equipment, but things that are installed into the building systems or into the building itself are not considered, would be considered part of construction. So like expanding your air conditioning system or putting a new air conditioning system, that's considered part of construction and not just putting a piece of equipment on the roof. It's installed. Similar things like window replacements or emergency power generators are part of the construction of the building and not considered loose equipment. So alteration renovation also includes those types of things like installing pieces of equipment or other permanently fixed items.
So if you have concerns as you plan out your project, please send them into the BIPIC contact form and we can make sure that Bill or another expert in minor alteration, renovation, and construction questions is able to provide you with a timely response. I see that we're almost out of time, so I'm going to turn this back over to Stephanie to wrap us up for today.
Great. Thank you so much, Olivia, for so expertly navigating all of the many questions that you all have submitted today. So before we wrap up today's call, sorry, there's just a little delay. Here we go. Before we wrap up today's call, here's a slide with some key technical assistance resources that may be helpful during the application process, some of which we already referenced today. So first, please read the SBSS NOFO, the FAQs, which we will be posting shortly on the web page, sample forms, the webinar recording. There should be a TA recording that went into much more detail than I did at the beginning of today's session. That's what we mean by webinar recording that we highly recommend you listen to. And other resources posted on the SBSS TA webpage as well. I think, for example, we referenced the sample project work plan. So be sure to check the webpage frequently as updates to TA materials will be posted as needed. Please look for different sets of new FAQs. And if these resources do not address your question, you can also submit questions to the SBSS Technical Assistance Team and refer to the contact section of the SBSS TA webpage for information on where to direct your question. You've probably heard us mention that BIPIC contact form many times throughout today's presentation, so that is where you can go. And to that end, here are some TA contacts, including contacts for budget and grants administration specific questions, as well as you see there's that BIPIC contact form mentioned again. So thank you again. We are always working to improve our TA and would appreciate your answers to the polling questions that you should see in the Zoom room. The answers will be private and not broadcast. And thank you again for participating in today's session and for your interest in expanding school-based health center services. This concludes our presentation.